I think we are live also.
Yeah, I think I can't see, so I can't get
I'm
them.
admitting. Yeah, you can't because I'm
Mhm.
not made you co-host. Wait.
Mhm.
Yes. Now you
Yes.
are.
Shall we start, Vrindaji?
Hanji, sir. Please, let's start.
जी। नमस्ते दोस्तों, मैं पारुल हमारे शनिवार के आज के सेशन में आपका स्वागत करती हूँ। दोस्तों, हमारे डाउन सिंड्रोम ब्लेस बच्चों में, एडल्ट्स में बहुत सारे हेल्थ इश्यूज होते हैं समय के साथ साथ, जिन पर हमें उन्हें डॉक्टर से भी मिलना पड़ता है, बात भी करनी पड़ती है और इलाज भी कराने के लिए कई बार हमें हॉस्पिटल जाना पड़ता है या इधर उधर। उसके साथ साथ फिर भी बहुत सारी चीजें ऐसी होती हैं जिनके लिए हमें कोई चाहिए होता है जिससे हम बात कर सके, पूछ सकें अपने डाउट्स। और इसी के लिए आज हमारे साथ एक बहुत ही खास मेहमान, हमारे बहुत ही इम्पोर्टेंट गेस्ट हमारे साथ हैं, जो हमारे डाउन सिंड्रोम फेडरेशन ऑफ इंडिया के साथ जुड़े हुए हैं। हमारे कॉन्फ्रेंसेज में आप उन्हें देखते रहते हैं हमेशा। और बहुत ही खास हमारे डॉक्टर हैं, वो डॉक्टर प्रदीप कुमार। आज हम उनका स्वागत करते हैं यहाँ पर। और उनके चेहरे पर मेरे बोलने पर आप कुछ भी असर नहीं देखेंगे, क्योंकि वो मेरी ये जुबान नहीं समझते हैं, बिल्कुल भी नहीं समझते हैं। तो इसके लिए आज हम सैमी को अपने साथ में लेंगे और सैमी के थ्रू हम डॉक्टर से बात करेंगे। मैं भी बात करना चाहती थी डॉक्टर प्रदीप से, लेकिन मुझे ये इसी तरह करना पड़ेगा। और मैं ये कहे कि सैमी आपको बुलाती हूँ, रेखा माँ भी बहुत हंस रही है देख के। सैमी, मैं ये कह के आपको बुलाती हूँ कि यार अब वो ना समझे हैं ना समझेंगे मेरी बात, यार अब ना वो समझे हैं ना समझेंगे मेरी बात, दे और दिल उनको जो ना दे मुझको जुबां। और सैमी हमारे डॉक्टर से मिलवाइएगा और ये उन्हें ट्रांसफर जरूर कर दीजिएगा।
Absolutely, absolutely. Thank you so much, Parul, and good evening, everyone, and welcome in today's session. Yes, today we have among us one of the specialists whom I mean the doctor from his area of expertise. We all discovered in our lives only when we were blessed with our extra chromies. Yes, I'm sure most of us as parents met the geneticist the first time ever with the when the genetic counseling of the parent who got blessed with the child with the diagnosis of Down syndrome was advised. But what makes our today's guest more special, like Parul also mentioned, that he's a part of federation from last 12 wonderful years. He is medical advisors on various parental organization caring for rare diseases, but he's one of our panelists, expert from Federation. He has been a meritorious student in all the courses he undertook to become the professional in his field. He is an excellent doctor who has been awarded by Indian Medical Association and also many times from Indian Academy of Pediatrics. He's a national speaker from Indian Academy of Medical Geneticists and Indian Academy of Pediatrics. He's also invited state speaker from IIA, Obstetrics and Fetal Medicine Societies. He is, of course, the DSFI Excellence Awardee for 2024, Dr. M. Pradeep Kumar, who's a consultant clinical geneticist in KMCH Hospitals and Geome Medical Center, Coimbatore. He's also president of the Genetic Wing, Benchmark Medical Trust. A thorough gentleman and a master of his subject. Yes, as Paru rightly mentioned, you have met him in the in our annual conferences many times, giving talks in his area of specialization and moderating our expert sessions. So today, sir is going to talk about the different kind of infections in the coming winter and monsoon seasons we generally face in regards to our self-advocates. How can we handle the situation? The reason behind our chance to require extra care as their body may respond differently to these common infections, and how to prevent and when to seek experts' advice. Dr. Pradeep Kumar, sir, we are very, very happy to have you with us. It's an honor. And before taking you as a speaker for today's evening, I want to mention what Parul mentioned, that she said that she really wishes from her deepest of, heart that if you could understand what she's talking. So she really, I think you be part of the conference for many more years, and she'll make sure that you learn a little bit of understanding of Hindi also. So thank you so much, Parul. Welcome, sir. A very warm welcome on this platform with us. We are waiting to get enriched by your experience and knowledge. Over to you, Pradeep sir.
Thank you. Thank you so much for the wonderful introduction. Thanks, DSFI, Rekha ma'am, Parul, Sani, for this warm welcome. And Parul, I may not understand your language, but emotions don't need language to understand. So I always understand your emotions. So with that, we will move on to my session. Maybe today I've taken a different role. I'll be talking as a pediatrician. Actually, you met me as a geneticist with genetic consultations for counseling, for prevention, all these aspects. But as a pediatrician, what are all the issues you are likely to face in this situation, that is in this season, particularly winter and monsoon season? And how could you avoid complications? How could you prevent all these infections? How can you escape from all these? These are the small tips I'm going to give you. And we'll move on with the session. Is it okay for everyone? Everybody has come. Shall we move on?
Yes, sir.
Okay, I'm sharing my slide. Can you see?
Absolutely, sir.
Yes.
Yes. Yes. So seasonal infections, the precautions we have to take. So winter, 1 second, it's not moving. Yeah. So winter and monsoon brings us few challenges. Specific environmental changes. Suddenly the climate, the weather conditions changes. The conditions become unpredictable most of the time. And wait a second. Yeah, sorry.
The slide is not going, right?
1 second. 1 second. Yes.
Yeah.
Stop and then I'll share again. Yeah. Yes. So, sorry for this technical glitch. Yes. Yes. So, yes. So, in specific environmental changes, environment changes, and whether we can accustom with that is a big challenge, particularly for our children. Cold air causes the respiratory system. Uh, Again, the challenge causes the respiratory system to go in for constriction. It won't allow that cold air current because it may actually start up an inflammatory process. That is why the bronchoconstriction can happen. This bronchoconstriction will lead on to cold, obviously, maybe sometimes into wheeze. And pollen particles are spread, and these act as allergens can affect our respiratory system. Rains and sewage contamination, not needed to say. Because of that, the water itself will get contaminated. The drinking water will gets contaminated. The food gets contaminated, and the children gets infection very soon. And rainwater stagnation. And when we get exposed to the rainwater stagnation, we get some diseases. And mosquito breeds in that. And because of that, there are so many infections we are facing. And all these challenges are faced by most of the children. Why our children with Down syndrome, are more susceptible for these infections? Why are they more prone for it? Why we should be extra careful? Can anybody answer? Why our children are more susceptible, can have more severe infections? Do you have any ideas?
Yeah, parents, it's going to be interactive if you want to pour down your wisdom about it.
The low immunity.
Low immunity? Yeah, very good. Very good.
Bronchial area narrow होता है. Bronchial area is very narrow.
Bronchial area is narrowing. Okay. Yeah. These are structural abnormalities. Yeah. And one more common one, cardiac abnormalities. 20 to 30% of our children can have cardiac abnormalities, such as heart disease, and this will cause pulmonary congestion. Because of that, it acts as a typical medium for infection to grow. But there are so many parameters which we have to consider when our children get infections. These are combinations of genetic, physiological, and also developmental factors. So genetic factors, we all know that there is an extra copy of chromosome 21 has gone into all the cells of our children. This chromosome contains genes. These are involved in immune system regulation, including those that encode interferon receptors. So these receptors are needed for proper immune response. And there are genes which are duplicated, which may not function properly. Duplicated means instead of two, there are three. Overexpression of these genes causes dysregulated immune response, impairs both innate and adaptive immunity. This is because of the duplicated genes, and their function is not proper because that immunity is affected. The other factors are the T cell deficiencies because of poorly functioning thymus. Thymus is responsible to produce T cells, which are immediate responding cells, immediate warriors against infection. Reduced T cell counts and their impaired function causes infections, deficiency to fight against infections also. Impaired B cells. B cells are responsible for production of immunoglobulin. These are also needed to fight infections effectively. Because of impaired B cell development also, there is difficulty in the body to fight infections. And innate immune dysregulation is because of hyper-responsiveness our children face. Their cells are at relatively higher level of hyper-responsiveness. A person this is just an example of an allergic person versus a non-allergic person. A person who is allergic to certain dust particles, if they get exposed to that particular dust, he may sneeze for 10 times, but a normal person will sneeze only for once. You can relate this to our children who have mild hyper-responsiveness in all the systems. Because of that, they have chronic and low-grade inflammation. This low-grade inflammation actually tires your immune system. Because of that, it won't fight effectively. And there are autoimmune conditions associated with hypothyroidism, celiac disease, or type 1 diabetes. All these are immune deficiency disorders, particularly type 1 diabetes. This again causes immune deficiency. Because of that, they develop serious infections. And hematological issues like neutrophil and macrophage functioning defects. This affects the cells which are fighting against infection. Neutrophils and macrophages are first-line defense mechanisms. Their functionality is also decreased. And unique to children with Down syndrome or transient myeloproliferative disorders, this affects bone marrow depression. This affects bone marrow. It causes cellular levels to drop. Because of that, the white blood cells will not fight properly. They will have anemia. Anemia will lead on to immune deficiency status also. Structural abnormalities, as rightly mentioned, children are born with structural abnormalities. They have smaller airways and they are hypotonic also. The hypotonia not only reflects muscles, but also in the airways. Because of that, there is no effective clearance of the mucus or even the foreign bodies or the infections. So ineffective clearance of pathogens from the respiratory system causes accumulation of these pathogens. They multiply inside, they cause recurrent respiratory infections. And we all know our children are prone for acute suppurative otitis media. They don't get infection directly into their ears. It is usually transmitted from the throat, from the mouth, through the Eustachian tube to the ears. Eustachian tube, in normal functioning Eustachian tube, will not conduct these infections. If it is affected, if it is compromised, then there will be each and every time when a child gets an infection in the throat, it will move to the ears and they get ear infections. So this is very common in children with Down syndrome. Their Eustachian function, tube function is not appropriate or not adequate. And our children have feeding difficulties. They have malabsorption, celiac disease, and hypothyroidism can cause reduced appetite. Their intake will be affected. Because of that, they may have nutrient deficiencies. And because of some behavioral issues, some choosiness also, many of our children don't take balanced diet. So because of that, there will be micronutrient deficiency like zinc, iron, vitamin deficiencies, which are very, very essential for healthy immune system. Our children tend to have premature medical issues like diabetes starts little early, like few disorders like early Alzheimer's we think of, early aging in various systems including cardiovascular system. Same thing happens in immune system also. They have premature aging so that as a adult or a elderly person, whenever they get some immunity, their immune memory wanes off. The similar situation happens with our children. Because of that, also they are prone for infection. So overall consequences of our children due to low immunity or recurrent infections, they will be getting more infections than neurotypical children, particularly of the respiratory and gastrointestinal tracts. These are common infections seen in our community. They get from their peers, but again, these are common ones, common systems involved. They have increased severity also. As a disease may manifest in a milder form in the sibling who's neurotypical may manifest in a little severe way in our children. The longer recovery time also makes them go on with medications, go on with the clinical evaluation. So all these hampers their neurodevelopmental therapies what we are giving, and it definitely is going to affect their development too. So reduced response to vaccinations and waning of vaccine memory also puts them into risk. So they may require careful monitoring, sometimes additional booster doses. So what are all the common seasonal infections during winter and monsoon months we should be careful about? Most of these infections are viral infections. We don't need to panic of all the infections. Whenever child gets a fever, don't need to panic. You don't become anxious. Don't have these sleepless nights with the child. So most of these most of these diseases they get during winter seasons, monsoon, are all viral infections. Viral infection means they are self-remitting. So their immune system, however little compromised it is, can manage these common viral infections. They affect gastrointestinal and respiratory. Most of the time, fever, cough, cold, throat irritation, vomiting, diarrhea, usually with basic medications like paracetamol, proper hydration, they come out of these infections. So this means that their immune system is fighting or simple infections where their immune system can fight against. Rarely, sometimes this may have a prolonged course of infection, prolonged course of illness. The child will not recover from the fever, or the intensity of the fever will not reduce after 3 days, or even if the infection or the fever is coming down, the general well-being is not seen in the child. They will have some excessive tiredness, decreased food intake, signs of dehydration, decreased urine output, and they may have some respiratory findings also. All these are some red flag signs we have to know. But most of the time, 70% and above, these children will respond, will come out of the infection without any major medical help. There are common upper respiratory infections we can see in this season. Common cold and flu caused by viruses, rhinovirus or influenza, adenovirus. They may have mild fever, cough, cold, runny nose, body pain. Usually by 72 hours, the symptoms settle and slowly the child will come out of the infection. They'll show well-being. Sinusitis means the inflamed sinus. They will have protracted runny nose. They will have pains in the head and all in the sinuses regions. That means the infection is sitting in the sinuses, or it has stimulated the sinuses. Because of that, there is continuous secretions. This again with the proper medical care. Maybe if it is confirmed, we can do postural sinus drainage, or we can give nebulations or regular salt water inhalations. Plain water inhalations, steam inhalations will help. Croup is a viral infection which children will have deep cough. That is barking, brazy cough. That is also common. That again is a viral infection. If they don't have severe manifestations, no breathlessness, feeding well, active, cough suppressant will do. If there is some difficulty in breathing, you have to reach your pediatrician with basic nebulations. They can reduce the symptoms or alleviate the symptoms. Streptococcal infections are common. These are bacterial infections which may need antibiotics. So examining the throat will give us a clue whether it is bacterial or viral infection. Some middle ear infections also, we will think in terms of streptococcus. And scarlet fever is a high-grade fever caused by streptococcus. All these infections, streptococcal group may need antibiotics along with the supportive care like proper hydration, cough suppressant, paracetamol. This particular group will need streptococcal infections will need antibiotics. So we will move on to the severe problems like lower respiratory infections. Till this upper respiratory infection, we are safe. We know that this baby is going to come up very well, no issues, nothing is going to happen. Basic outpatient basis medication will do for these children. But again, when this happens, when the infection moves down to lower respiratory tract, that is your trachea, bronchus, and the lungs, then it becomes a serious infection. So most common are pneumonias and viral triggered bronchitis. Bronchitis means there will be phlegm accumulation in the lungs that may not be a patchy one because of the clearance is affected because of inflammation caused by viral infection. They will have this wet cough, that is the phlegm sound you can hear when the child coughs. That means it is bronchitis caused by viral infection. If there is pneumonia, there will be additional findings like high swinging temperature, breathing difficulty. The well-being itself will be affected. So for bronchitis, we may need to give salbutamol or some supportive medications like basic nebulization if the child needs. Most of the time, bronchitis will the children will come out of bronchitis because it is a viral infection that has triggered the bronchus, but it is no longer there. The reactions are there. The reactions will soon settle down with antihistamines, with cetirizine, like your salbutamol, with mild nebulations if needed. But pneumonia is a serious complication. That means there is an infection, ongoing infection in the lung parenchyma. That infection has not gone. There is infection sitting in, organisms are multiplying, they are damaging the lung cells. Then you need proper medications, particularly if the pneumonia is proven by X-ray or blood test, they show high bacterial counts. They may need IV injections, IV antibiotics, along with that bronchodilators and chest physiotherapy to bring out the secretions, so that secretions will not act as a nidus or a media for the organism to grow. Sometimes children with Down syndrome, because of the shortened or narrow airways, prone for the inflammatory properties, they may develop wheezing or asthma. So wheezing is milder form. Asthma is recurrent episodes of wheeze whenever the child has respiratory infections. So this can be triggered either by cold air exposure, by the air current, or because of the weather changes, or increased indoor allergens. It can be some pets from birds, or even some pollens from outside. Some battis we use at home, agarbattis. All these smokes, or somebody is smoking. Child may have passive smoking. Because of that, they may develop wheeze or asthma. First thing is you have to take off all the triggers, avoid triggers, and if in case it is because triggered by respiratory viral infections, this episode will settle soon. So asthma, allergies, bronchitis, all these can happen without infection. Bronchitis is a triggered one. Pneumonia is a sitting infection. So asthma, allergies, bronchitis can be managed with milder bronchodilators and antihistaminics, whereas pneumonia is a serious problem. We need antibiotics, maybe IV most of the time. And once the baby improves, then we can send the child home with oral antibiotics. Bronchiolitis is a specific condition caused by respiratory syncytial virus, common in infants and toddlers. Usually it is benign. It won't cause major abnormalities other than children with having congenital heart disease. This may progress to respiratory failure also. Otherwise, this again, when you give supportive care, they will come out of the infection. Amongst these infections, you would have heard about this virus. So viral infections, the common one is influenza. These are called seasonal flu. They are prevalent during the rainy season. They are the top cause of some fever illnesses. They change their shape. They mutate. It is like, the simple example is in COVID time, what are all the types you have seen? Anybody can answer? COVID, some strains we would have heard of, no? Anybody there going to answer?
H1N1.
So the COVID, then what what other thing we would have heard of about COVID? Delta variant, Omicron variant. So, but they are COVID only. No? They changed their structure. They started changing their appearance. It is like they are changing they are just hiding, or they are cheating the immune system of the person. They change the structure. Same way, influenza usually change. Their structure will change. Because of that, new strains will come. Every year, you are seeing a new strain uh, of influenza. Even the bird flu, the pig flu, whatever you are hearing is a mutated strain of this influenza only. Most of the time, it presents with fever, headache, body muscle aches, cough, sore throat. Vomiting, gastritis can be associated. Sometimes it involves the GI, gastrointestinal system also. The serious infections are seen in children less than 5 years and elderly people, or with those immune deficiency. Maybe we can consider our children have milder immune deficiency. I will consider our children have more tendency to get serious influenza. So why we have to know about the strains? Because the vaccination changes every year. Every year you have to give influenza vaccine. This new vaccine will have the new strain, so that the immunity developed will be complete. Influenza prevention is simple, like any other respiratory infections, like COVID. What we did, we wear masks and washed hands and eat hygienically. Immunization protects against severe illnesses. Severe influenza will not be seen in children who have been vaccinated previously. It is recommended yearly because new strains are seen every year. So the vaccine companies update every year their vaccination. This should be given 1 to 2 months before the global outbreak. We suggest around July to August in India, our children need to get influenza vaccine yearly once. The serious infections with influenza are preventable if the vaccination is given properly. Why I'm stressing this? Because influenza will come and go. It may resolve on its own. But again, that would have created an inflamed airway for your child. There, another secondary bacterial infection will come in. This is a compromised airway. That secondary bacterial infection come in and will set a pneumonia there. So you prevent influenza severe manifestations, so that you prevent second or third or fourth bacterial infection also. So it is worth giving a influenza vaccine every year. The serious issue, as far as lungs are concerned, is the pneumonias. This is infection, the bacterial infection has traveled into the lungs. It has settled in the lung parenchyma. It has started multiplying and it started destroying the lung tissue. So this is called invasive pneumococcal disease. Most of the time, these are caused by pneumococcus. This is the main cause of pneumonia. Sometimes this may progress too. If this infection enters the bloodstream from the lungs, from the blood vessels, if it enters and it goes, settles in various other organs, that is called septicemia. If it involves the brain, it is called meningitis. So everywhere it goes, multiplies, destroys the tissue, and causes so many damages to the organ system. They present with high fever, breathlessness, severe headaches, nausea, vomiting, stiff neck in case of meningitis, that is brain infection. Small children will show irritability, lethargy, seizures, shock, and death. This is a serious concern. WHO and UNICEF says that this is the leading cause of death amongst children under 5 years old globally, with up to 2 million deaths per year, which is more than AIDS, malaria, and measles combined, all three combined. So this pneumococcal pneumonia, which is a serious life-threatening disease, can again be prevented by vaccination. So you would have heard of this pneumococcal vaccinations given in the infancy that prevents serious infection. It may not prevent pneumonia. It may not prevent pneumococcal infection at all. It will prevent serious infection like pneumonia, like meningitis. So always these vaccinations go attack the immune system in a lower dose, create the immune response, and later on, when the real bacteria comes in, our immune system will be ready to face that bacteria. So these are some of the airborne diseases we face during the monsoon and winter. Next comes your waterborne diseases. Most common is diarrhea and gastroenteritis. It means the infection has gone into the stomach and intestines somehow. How it will go inside? Mostly by ingestion. Whatever we are eating, the food we are consuming, the water we are taking, if it is contaminated with this infection, that bacteria or virus which is gone inside will multiply inside and create irritation in your gut, in the stomach, and in the intestines. This causes diarrhea. So it is excreted to the patient's feces, and this leads to easy outbreaks, because if that person is not maintaining adequate personal hygiene, that causes easy outbreaks in the community. So usual diseases, viral diseases, are viral. Most often viral. Vomiting, they present with vomiting, gastritis, poor feeding, they'll have watery stools. Once the gastritis improves in 1 or 2 days, the intake will improve, the well-being will be there. You will have something to give. You can give something inside through the mouth. If the child is throwing continuously because of gastritis, maybe we may need to give some medications for gastritis, like pantoprazole, and vomiting controlling medications like ondansetron or domperidone has to be given. Once watery stools the child started throwing, then it has gone into the gut, into the colon. Then the gut is reacting to the infection. It is actually washing away the infection. With that, in that process, gut is losing many electrolytes and big amount of water. So this leads to dehydration and electrolytes imbalance. Because of that, we have to concentrate on rehydrating the child as much as possible, giving oral rehydration solutions, giving plenty of water, giving plenty of buttermilk, giving tender coconut water. All these will help in rehydrating. Oral rehydration solution is a recommended treatment which will prevent dehydration, which is the only known severe complication of most of the viral diarrheas. Most of these viral diarrheas are self-remitting. They settle over period once you maintain the hydration. Rotavirus is the culprit behind gastroenteritis in infants and young children. Am I audible? I'm just checking.
जी बिल्कुल जी हम सुन सकते हैं आपको. Yes, you are.
Yes. Rotavirus is the culprit behind gastroenteritis, and again, this rotavirus can be prevented by oral vaccination that is available. So infective diarrhea, we have finished the viral diarrhea. We are coming to infective diarrhea. The common infection, it is ingested only. If it is viral, here will be like that. And if it is bacterial, they may have foul smelling, blood stained, mucus, green color, small quantity of stools gives us clue regarding bacterial diarrhea. Amoebiasis, children will have severe pain. They also will present with watery diarrhea, sometimes with dysentery, that is blood-stained motion. High-grade fever and vomiting. Dehydration is the main cause of increased mortality. Again, hydrate the child well. How much ever the body pushes out, rehydrate. You are giving clean water inside. The gut is pushing all the bacteria and the virus outside. So here in this infective bacteria, if you go to a pediatrician, they'll identify whether it is infective or viral. If they feel that this looks like an infective diarrhea, they'll start the baby on antibiotic and it has to be given. It will take 3 days at least to act. Till then, we have to hydrate, maintain urine output. Probiotics like lactobacillus, normal bacteria will be given with supplementation. This will take care of infective diarrhea. Sometimes these infective diarrheas, because of high-grade fever, can throw convulsions. So this is well known. Here again, giving adequate paracetamol, keeping the environmental temperature cooling will help children maintain the normal temperature. This will avoid serious complications like seizures. Same way, by ingesting an bacteria, you can get an infection called typhoid fever. So if when we will think in terms of typhoid fever, the fever is not settling beyond 5 days and it is continuous. Baby's intake is severely affected. They may have gastric symptoms, may not be like continuous diarrhea, but they will have gastric symptoms. And all these will give us some clue. So all these will give us some clue regarding the infection. This again is preventable. There are 2 doses of typhoid vaccine. This will increase the severity of infection. Most often I see, whenever you send reports, I see children were subjected to Vidal testing on 2nd day or 3rd day of fever itself. That will show false positive results. And this is not a real infection. Usually the Vidal test, if you are doing, then it should be done after 7 days. Then only it will show positivity. First 1 week, the typhoid infection will only be seen by blood culture. So sometimes most of the pediatricians will not do Vidal before 1 week. If you get a result saying that Vidal is positive, don't panic. We will help you out when it was done, what treatment has to be given, whether it is strongly positive or not. All these will be taken care of. Most of the children with typhoid fever, if they have proper appetite, their intake is good, urine output is good, their well-being is good, they're active, walking around, we can manage them with oral antibiotics at home. Sometimes if the baby is not there, IV fluids, injections, and antibiotics has to be given. They need admission for 2-3 days unless we settle. So typhoid fever is not an indication for admission. Only the child's well-being or not is the will decide whether the child needs admission or not. And as I said, preventable vaccination is available. Next comes again contaminated water and food, hepatitis A. This is very common. Typhoid and hepatitis A are very common when you eat outside, particularly uncooked food like fruit salads. So hepatitis A and E are highly contagious viral liver infections. They affect unimmunized children, leading to fever, vomiting, abdominal pain, later jaundice. So they are transmitted to viral contamination, uncooked food, drinking water, unhygienically prepared cut fruits or fresh fruit juices. Though these are self-limiting, they may occasionally lead to liver failure and coma. So 2 doses of hepatitis A vaccine can provide 100% protection and has to be given. No vaccine is available for hepatitis E. They present with fever, loss of appetite. Maybe after 3-4 days, after you treat them with proper medications, they will have yellow colored urine, and we will see that liver enzymes are elevated, the bilirubin will be high. But most importantly, this again is a self-remitting disease with supportive care, with proper diet, proper hydration. Children will come out of the infection. Most of the children will come out of the infection, and the liver will regenerate over a period of time. So, but again, this is vaccine preventable. Another group, because of monsoon, rain stagnation, we see in films that many people will play in the rain, and that is seen to be a wonderful romantic scene or something. Or children also love to play in water. But again, we have to make sure whether the water is contaminated with sewage particles or not. This is commonly called as rat fever. This is called leptospirosis. This bacteria is actually eliminated from the rat's urine if the monsoon rainwater is contaminated with this rat's urine. It may not be directly, it may be from the roof. Rat would have pissed there, and the water comes down. And when child or even adults, when we get exposed to this water, so through the abrased skin, in small cracks of your skin, this leptospira will enter, and this may become a serious complication. And we have certain parameters, certain indicators to think of leptospira. They'll have high-grade fever, not settling with most of the common medications. We will test, and then we will find out. This is one of the notorious cause, particularly in Chennai. We see so many cases, not in Coimbatore. But again, wherever water stagnation is there for a long time, and children are getting exposed to that, leptospirosis we have to think of. So this is regarding waterborne, either ingestion or through your cut wounds. And previously we saw respiratory. Third comes your mosquito-borne diseases. So monsoon season, stagnation of water everywhere, and that is the ideal place for the mosquito to build their house, live, multiply, and enjoy with their children, and they feast on your blood. So the cause, and most often, which creates a panic feel for the family, is your dengue fever. This is transmitted by Aedes aegypti mosquitoes. These mosquitoes bites during daytime. If you would have seen the Aedes mosquito, they will have small dots. They look beautiful actually. So they bite during the daytime, and the presentation will be high fever for 3 days, redness of eyes will be ingested. They'll have severe pain behind the eyes. They feel weak, abdominal pain, headache. They have muscle pain. It will be like they cannot get out of the bed. So rash usually appears from 48 to 72 hours. The typical presentation usually for dengue fever is 3 to 4 days of fever initially. Then they will have 2 to 3 days of afebrile period. Then the fever restarts in the 5th day or 6th day. This time, there will be excessive tiredness, or this time there will be improvement. If the child improves in after the biphasic second phase, then the child is not having a severe viral dengue infection. If the child becomes excessively tired after the new onset of fever, or if the fever is settled, then the child becomes excessively tired, dehydrated, intake is affected, then we have to think in terms of this. So biphasic with initially fever, excessive tiredness, later on they will go for, so some children will go for the complicated dengue. So complicated dengue, there will be hemorrhagic tendencies, bleeding tendencies, the platelet starts falling. So there are two parameters we will be more worried about. One is any hemorrhagic tendency, any bleeding, or there is volume loss. That means there is third spacing. The water will stagnate in the around the eyes or in the peritoneum. It will not be in the intravascular plane. That means there is third spacing of fluid. So they have hypotension. The fluid will not be adequate in the intravascular compartment. These are some complications we see. This is called dengue hemorrhagic fever. Again, no need to panic when you see there is thrombocytopenia. Thrombocytopenia, platelet count will come down, and once it, again later on it will pick up. But what we are more worried about is the shock symptoms, whether they have hypovolemia, excessive tiredness, peripheral pulses, or urine. This is actually is a panic situation than thrombocytopenia. Platelets are high, 1 lakh, but the child is not doing well, hypovolemia. I'll be more worried. Platelets are 40,000, but the child is comfortable, running around, feeding well, urine output is good. I'll be more relaxed. But most important statistics you have to know is 99% of the dengue recovers like a normal viral infection. Out of 100 children infected with dengue, 99% recovers without any medical support, no need for admissions and all. They may need oral medications, proper hydration, they'll improve. 1% only goes in for complications like thrombocytopenia, like bleeding manifestations or hypovolemia. They may need supportive care, but in that also only 0.1% goes in for severe life-threatening complications. So 99.9% dengue illness will recover. There is no need to worry about the life-threatening event. The best prevention: avoid mosquito bites, use mosquito screens, repellents, use full sleeve dress, and eliminate breeding sites, which the government is very strict about. And research is going on with the development of vaccine, and we are expecting that very soon. Malaria is another mosquito-borne, mosquito-transmitted disease. This mosquito, Anopheles, bites at night. The high fever, chills and rigors, 10 to 12 days after mosquito bite, they again have severe manifestations. Untreated can be life-threatening. Only thing is we have to identify whether malaria is present or not. With proper investigations, your doctor will find out. Once anti-malarials are given, the child will improve dramatically. Prevention, again the same thing: avoid mosquito bites and destruction of mosquito breeding sites and appropriate clothing. So risk is on for development of malaria vaccine. And malaria actually is restricted to few endemic regions. Like in Chennai, malaria is very common. But in Coimbatore, dengue is more common than malaria. We rarely see malarial infections. Chennai, it is both malaria and dengue. Here, more of dengue here. You have to know about your city also. And Japanese encephalitis is another mosquito-transmitted disease transmitted by Culex mosquito, mostly in rural areas where pigs serve as an intermediate host. That is, the mosquitoes, they will go bite the pig, the JE virus will be inoculated there. Pigs actually multiply the virus, and then that will be taken back from the pig and to the human being. So the illness is severe in young children. Most of the older children, they come out of the infection like general viral infection. It may lead to death or severe neurological handicaps in those who survive. 2 doses of encephalitis vaccine is also being used, and 1 to 15 years of age it can be given. It gives lifelong immunity against the disease. And this is again restricted to few districts of Tamil Nadu. I'm talking about Tamil Nadu only. So North Arcot district, they say all these Kadalur, Ariyalur, all these regions, they are very prone for Japanese encephalitis. Other regions, we are not seeing this. So this is about the mosquito-borne infections, malaria, dengue, Japanese encephalitis. And we will move on to the common skin infections and conditions. Most common are fungal infection because of the water, the exposure, or because of the moist nature of the environment. So ringworm, athlete's foot, or candidiasis, they are very common. Impetigo is a bacterial infection. Go seek medical help, and these can be settled. Eczema is not a infectious condition. It is because of the dry skin. Our children have dry skin. They may have hypothyroidism, which again gives which actually worsens the dry skin. And if they are exposed to winter season, even a normal person like us who are having normal skin, the neurotypical, or children with Down syndrome having normal skin will have mild dryness. So other group who are having dry skin, they will go in for eczema. Eczema is extreme dryness of the skin. They will have cracks in the skin. They will have eczema. They will have extensive skin rashes that will need proper moisturizing. And sometimes, if it is very severe, may need mild steroid creams. And frostbite, again, exposure to cold temperature, proper covering will help. Hand, foot, mouth disease, most of your children would have had this. Everybody would have come across this one. This is caused by virus only, but they will have severe lesions in the mouth, in the hands, palms, soles, in the buttock region, in the knee, all these places they will develop. Usually resolves in 3 to 10 days. We have not seen any serious complication with this disease. This is mostly self-remitting. Only thing is when the children get so much of pain and ulcers in the mouth, it will be difficult for them to eat and drink. Once you take care of that phase, then they will come out of the infection very soon. Prevention is by hygienic food, drinking proper water, avoiding crowded places, and personal hygiene. Chicken pox usually is a summer infection for South India. North India, chicken pox is encountered even in winter seasons. This is through contact of with friends and school. Again, vaccines are available. It is like blisters, small water droplet-like infections. You would have seen the skin rashes will appear like that. It is centripetal. It will start from the trunk. It moves towards the peripheries. And this is again vaccine preventable. We have medications. Sometimes in Tamil Nadu, they think in terms of this is Ammai. We should not treat. Ammai has come, the goddess giving some infection. These are myths we have. But if you give them proper medications like acyclovir, antiviral drug, the serious complications like scarring, the dot scars will appear. No, that will not be seen. And you can immediately stop the spread of multiplication of chicken pox in your body. And this is a vaccine preventable disease again. So we are moving on to the final session, final part of my talk, preventive strategies. Airborne infection, it is through the air only. So avoid crowded places. Imagine you're in a COVID situation. So mask, frequent hand washing, avoid exposure to smoke, dust, and cold air. This is particularly for frequent wheezers or asthmatics. And vaccinations are available for influenza and pneumococcal. Pneumococcal for younger children is better to give. Influenza yearly vaccination will prevent major serious illnesses during the winter season. Food and waterborne hand washing is the key here. Safe food practices. Avoid cut fruits outside. Unhygienic eating places you have to avoid. Ensure safe water. Personal hygiene important. And vaccinations available are for typhoid, hepatitis A, and rotavirus. And this can prevent serious infections again. Mosquito transmitted diseases. Mosquito bite prevention by mosquito nets, repellents, full sleeve dress, mosquito breeding regions. So vaccination is there for Japanese encephalitis, not for malaria or dengue. We are expecting that vaccine very soon. In general, most of these infections are self-remitting. And we have to be aware that our children have a little bit compromised immune system. So if you cannot apply this all the time, even a milder infection can progress to serious infection if your child's immune status is compromised. So beware, but again, don't be panic all the time. Whenever child gets infection, don't get panic. All these can be self-remitting. Most of the time they settle on their own. If it is taking a prolonged course, the fever is more than 3 days, persistent vomiting, diarrhea, child is not passing urine well, the general well-being, if it is affected, child is not active. During fever, child will not be active. That I can understand. After fever is reduced, after you have given paracetamol, child is afebrile, lying comfortably in the bed, and but is not eating well or not feeling good, or having some botheration in the body, then think of some serious illnesses. You may need medical help. So rapid and labored respiration in terms of breathlessness is a manifestation of most of the lower respiratory infections, and difficulty in breathing and feeding. General well-being is affected. If the urination is reduced, then hydration is affected. All these situations, you may need to take medical advice properly. And self-medication, better to be avoided. Give only the standard medical treatments which are recommended. So don't try everything. Whatever comes through WhatsApp, don't try on your children. They are not our guinea pigs, because these medication, whatever you are telling, all these has to go through a process of trials, starting with the pigs and then to the man, and then the various levels of trials, and then comes to you. So better avoid self-medication, especially use of antibiotics over the counter should be strictly avoided, because we are running out of antibiotics. Now the era has come where we are looking for other options, because most of the bacteria and viruses, they change their face, they change their structure, so they escape the antibiotic, most of the bacteria. So we are seeing many resistant bacteria, drug resistant bacteria, which are very difficult to treat. In the future, that will be a big headache for our society. Avoid antibiotics unnecessarily. So for our children, they need regular health monitoring. It is not that only during some winter season you run, go get treated and coming. Take that master health checkup for children with Down syndrome regularly. That is for a regular counts, clinical evaluation, thyroid profile, whether their weight and height are normal, vitamin deficiencies are there or not. A general checkup is needed every year, minimum every year, at least 6 months once. And we only have countable, that's just 20 or 22 diseases with vaccination. There are thousands of diseases in the community, but the vaccination number is limited. These vaccinations are aimed to prevent serious diseases. It is not given for some common flu. Nobody is recommending vaccination. Vaccinations are recommended for serious illnesses only. Ensure the child is vaccinated on schedule with additional on annual influenza and pneumococcal vaccination. Balanced diet and supplements are needed. Proper weight. Don't be obese or underweight. Most importantly than the weight, what is more important is nutritional sufficiency. Nutritional deficiency should not be there. These micronutrients like iron deficiency, vitamin deficiencies, mineral deficiencies put the child for extra risk of infection. So prompt treatment is early medical interventions for infections to prevent complications. Don't prolong too long. If the child is not well, not eating, the well-being is not there. So always ask for specialist care if a pediatrician thinks he is unable to handle that it is a serious illness. You can get a pulmonologist opinion or hematologist opinion or immunologist opinion to manage these our children. So I hope I would have covered most of your queries. And if there are any further doubts, I'll be happy to answer.
Yeah, absolutely, sir. Thank you so much, sir, for empowering us with the knowledge we need to really move forward in these difficult weather conditions. Parul, would you like to add something in Hindi quickly?
जी बिल्कुल, बहुत बहुत धन्यवाद डॉक्टर। जिस तरीके से आपने इन्फेक्शन की सारी बीमारियों को कैटेगराइज करके हमें बताया है, और जो रेस्पिरेटरी वाली बीमारियां होती है जिनमें खासकर हमारे बच्चों को प्रॉब्लम्स आती हैं, उनके बारे में जिस तरह से जानकारी दी है, मुझे लगता है पेरेंट्स को बहुत उससे हेल्पफुल रहने वाला है, और एक आइडिया हमें जनरल मिल गया है कि किस तरीके से हमें बच्चों के इन बीमारियों पर ध्यान देना है। तो आपके जो भी क्वेश्चंस हैं डॉक्टर से आप पूछ सकते हैं हैंड रेज करके, या फिर चैट बॉक्स में आप लिख सकते हैं। हैंड रेज करके जल्दी से जल्दी अपने सवाल पूछिएगा प्लीज, ज्यादा समय नहीं होता है हमारे पास, फिर लास्ट में आपके सवाल आते हैं, हमें मुश्किलों में डाल देते हैं। तो आप प्लीज जल्दी से अपने सवाल
there are two questions already there. One is the parent is seeking advice from you. I would like to read the question. It says, good evening, sir. My child is Ayansh. He is 6 years old. He is always suffering from running nose and throat infection. When I consult to ENT specialist, doctor advised for tonsillitis. Doctor diagnosed tonsillitis and advised antibiotics and which is I think one is anti-allergic for 1 month, but still problem is going on, and doctor advised for tonsillitis operation. So need your advice. Also, some nasal spray named as mometasone.
Omeprazole.
They're
Yeah.
using. Yeah. Sir, what
Okay.
would you
So
advise them?
child is now 6 years old. I hope he should be in some schooling definitely. So he will get recurrent infections from his peers. So that is the source of infection. Suffering from running nose and throat infection, fine, that is all okay. If that is settling down with basic medications, these are benign, simple infections. So, but again, doctor has seen that there is tonsillitis. Because of that, antibiotics are given. And Montelukast, levocetirizine, and mometasone, all these are more of anti-allergenic or anti-inflammatory or the triggered, viral triggered, infection triggered long-term uh, problems like your running nose. They are trying to settle down. These are like infection has come and it has gone, but it has stimulated the airway. The airway is hyperreactive. They want to settle that. Because of that, they are giving levocetirizine, mometasone. All these are okay for me. Tonsillitis surgery actually is a controversial topic. At 6 years old, directly going in for tonsillitis, most of the time we directly don't advise. We will wait. We may need to get a secondary opinion. We will ask for ENT surgeon to look for whether adenoids is also involved, how severe it is. Is it not settling during the non-infectious period? When the child is active, no infection, at that time, is the tonsils, adenoids are seen or not? Then if it is settling down at that time, again, when he gets fever, the tonsils and adenoids are swollen, then it is okay. Because we need to preserve that by 9 to 11 years where that the immune mechanism itself will shrink those. If in case the child has obstructive sleep apnea, child is getting up with air hunger because of that obstruction, because of adenotonsillitis, then that is a direct indication for tonsillitis, adenoiditis. But maybe I would advise you can continue these medications. Small infections you can treat at once and see. Just watch him over summer, how he behaves. If he is okay in the summer, the tonsils are reduced, adenoids are shrunken, only in the winter season it is enlarging, then we can wait on it. Otherwise, if the child is getting up during sleeping, has heavy snoring, getting up with air hunger, then it is a direct indication you have to go ahead with the surgery.
Yeah.
You may need to take second opinion from another ENT surgeon also, because
Yes.
these are little subjective decisions to make.
Yes.
This is the overall idea I will
would
give
also
you.
like to suggest to the Bhabagri Dasji that you please do watch our last session we had with ENT specialist. There he talked about in length about tonsillitis to be removed or not to be removed. So take some knowledge from there and do consult another ENT in your area. So the next question is that the mother asked
Okay,
that
thank you, ma'am.
yeah, I would like to read it for the journal people or the people who are going to watch it later. That a mother of 2 years old boy is asking that he has cold since 1 month, and nowadays he has a running nose, morning to afternoon, and is it common? It's just morning to afternoon he has runny nose. Sir,
You
what
can
would
leave it, ma'am. Runny nose is quite common.
yeah,
So you don't need to treat it vigorously.
yeah,
And we used to say to the parents, till the nose is there, running nose will be there. So it is like, it is very common. So
yeah,
you don't need to worry. If it is affecting him too much, or there is continuous sneezing episode, he is having, then that means in that mid-afternoon time, morning to afternoon time, he's getting exposed to some allergens. Maybe you can make a note of that. If that is there, you have to take off the allergen. We don't want the child to get continuously exposed to it. But common cold following which there is mild runny nose is okay. We don't want the nose to be dry all the time.
yeah, yeah. So there's another question. It says that my son is 4.5 years old, acquires diarrhea as the first sign of any infection in the system and goes weak, followed by GRD and respiratory infections and drains easily. And when we try to seek medical care, they keep They keep saying he is better and can be managed at home despite heavy wheezing and 2 episodes of RSV pneumonia at 13 months and 3.5 years of age. He gets more hypotone and veins are tough to find for hospital admission in his fast dehydration and hyper to resist nurse care or at ER is the reason stated often. Is it common to make our kids drain so much before any early medical care or admission? He's from Chennai. Arvind is asking.
Okay. So try to acquire diarrhea as a first sign of any infection. I mean, it is not like the gastrointestinal system is weak. Whatever the infection child gets, child has diarrhea. It is not like that. These are most of the infections. What you see are viral infections. They involve multiple systems. Even the Madras eye, we used to say the conjunctivitis is a viral infection. They'll have cold, they'll have loose stools also. So it involves multiple systems. Maybe that is the reason he's getting diarrhea and GERD, reflux disease. Again, there is no infection. The child is getting these, getting reflux. You may need to treat that because they are prone to get reflux disease. The reflux disease you are actually relating with infections. Maybe that may be a separate entity that has to be addressed. Reflux disease alone has to be addressed. That may be adding up to the problems, complications with the child they are getting. So children tend to behave differently. The small infections may make the child very, very tired. Sometimes even some children will withstand a serious illness also. It depends on the personality as well as the physical condition, body condition. You have known this. So start from first day itself. Start hydrating him slowly. If you do that, most of the time child will not land up in admissions or IV fluids. Okay. So getting a difficult line again in pediatric age group, it is a big problem only. But in Chennai, most of the doctors, most of the hospitals, they will manage these children very well. So I'm very confident that there shouldn't be any major issue for your child.
Yeah.
Keep under supervision with the pediatrician, even during normal period. So he's now 4.5 years. Just check whether any vaccinations are pending. If he during the well-being period give all these vaccinations, look for GERD. When there is no infection, also GERD is causing problems. You have to ask your pediatrician. And small infection you can manage at home. It is very severe only. We have to go to the hospital because hospital is not the place where children will love to be with. So unless it is needed, no need for hospitalization.
So as sir also mentioned that proper nutrition and nutrient sufficiency and hydration is very important. So let's, as a parent, take care of that. So Dhanalakshmi wants to ask that very well explained, sir, all the issues. Her daughter is 6 years. She says that she has cold and cough for a month, giving medicines daily but running nose is still not reduced and cough is also there a little bit. Cough has reduced a little bit. Can we continue the medication or else have to change the medicine?
Maybe this season is relatively bad. Children were getting continuous one infection after other, and they go to the school where they will not know any personal hygiene. They cough on their face. All the infections will be shared amongst them. That may be the reason for the continuous infections. Maybe running nose, you can reduce a bit with the mask. The cold air exposure will trigger running nose, and we don't recommend medication more than 5 days to 7 days just for the running nose. Slowly, it will usually settle down. If it is a milder one like
He says that climate
cetirizine,
change also, when the climate gets cold,
yes,
the episode gets long, like a month.
close the ears, use a mask, use that monkey cap, use a mask when she's going out or getting exposed to that cold breeze. That may prevent a bit. But we cannot stay like that for 24 hours. When she gets during cold season, you can try mild antihistaminic like cetirizine or something for a week. After that, you can just leave it. You cannot completely stop this running nose.
Yeah. As a child, I also had all the time running nose, and I do hardly remember that I had got any medication for it. So till the COVID hit, I never encountered a running nose as an adult. But after COVID, the immunity has really gone down, and now I'm feeling that, that cough is persistent. It's not going, but whenever I'm coughing, the phlegm is coming out. So maybe, after COVID, a lot of changes in our bodies have also happened. This is what doctor mentioned. So as of now in the chat box, this only, sir. And anybody wants to ask question can raise hand. Parul, do you have any query? I must ask. Last time I just forgot to ask you. You raised hand.
नहीं, बिल्कुल मेरी वही रहती है प्रॉब्लम कि जैसा कि मैंने बताया था लास्ट टाइम, चांदनी को वो सब अभी फिर से स्टार्ट हो गया है।
Yeah.
उसका गला बैठा हुआ है बिल्कुल, और रनिंग नोज, और वो बोल भी नहीं पाती, कौ 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 ऐसे करके बोलती है जब ये है। इसमें दवाइयाँ तो उसकी चलती हैं, एंटीबायोटिक मुझे चलानी ही पड़ती हैं। तो क्या ये सही है इतनी एंटीबायोटिक उसकी चलाना, और इसके लिए मैं क्या और एक्स्ट्रा कर सकती हूँ?
Sir, Paru wants to ask that daughter is, I mean,
टीन
teenager, and she has sore throat, and every time when the cold hits, this happens. Her nose becomes, blocked, and it is very difficult for her to talk. And every time she has to give the antibiotics so that she gets some relief. So giving antibiotics every time when she's encountering these kind of infections, she's a little apprehensive that is it okay or any other method can.
Yeah, for all the sore throats, doesn't need this antibiotic. Okay, sore throat can be viral and bacterial. Examining the throat will give us some clue whether it is bacterial or viral. Most often, when she gets sore throat, start her on gargling. Best is simple method is warm water with salt, and that gargling will do. That will prevent bacteria or virus multiplying in the throat. If you leave that at that period, this starts multiplying and infects, and then you will land up in giving antibiotics. Give her proper gargling initially itself, and whenever she is eating something cold, say when children used to eat juices or ice creams also, they can drink a bit of warm water so that that won't stick there.
Yes.
So this first aid medications you can take. If you are worried that whether we are giving antibiotics too much, then you can ask your pediatrician or the physician whether this is really bacterial. Should I wait and give? Shall I wait for 3 days and see? And there are betadine gargles. If the child is okay with that, betadine you can try. Chlorhexidine gargles are available. These are medicated gargles that will give some sort of pain relief also will stop multiplying virus and bacteria. That can be used as a first aid, and if it is not settling, then you can go for antibiotics. Maybe this will reduce 50% of your antibiotic need.
Yes, okay. Betadine gargles and warm saline water she use for gargle. But can we give her steaming? Steam दे सकते हैं?
Yes, steam is more of a stuffy nose or the sinus if it is blocking. Then you can give. The running nose is started, nose is stuffy, that facial congestion is there. Steam inhalation will help. Not exactly for the throat. So throat, it is progressing to the nose and the sinus. Then all these are blocking. You want to relieve it, steam inhalation will help.
Thank you, doctor.
Yeah. Thank you, Parul. Sir, the parent from Chennai wants to know that how they can reach out for your appointment and counseling. Once again, if you can share where you are found in Coimbatore.
No, I'm in Coimbatore. I do visit Madurai, Erode, and Trichy, not visiting Chennai for medical consultations. They can get my secretary's number and have an appointment also. Online consultation also is possible.
Yeah. So, Arvind sir, you can ask.
Brinda can help. Yes.
Yeah, you can ask in our parent support group. Brinda ma'am will be able to provide you the sir's secretary number, or where he sets those numbers so that you can get connected. So
Sure.
I think we have actually overshot with few minutes when we have actually, it was an informative session, and we really wanted to hear and sir's thorough explanation of these common infections and sharing about, the preventing actions and treatment options, and also telling about what can be managed by the available medical intervention and can be well managed by doctor's advice, where not to panic. And thank you so much, sir, for this enlightenment. And we really appreciate your compassionate approach towards the healthcare of our champs, which has always made a significant difference in our parenting style, and also in, we being a proactive parent. Thank you so much for
Actually,
empowering us.
Sammy, I
No
have to
question.
say this.
Yeah,
This is
please.
Brinda here. I
Yeah.
have to say this. Sir is my go-to for anybody who sends me. They send me one information on medical that they want, and it goes directly to Pradeep sir. And I swear, he's never ever not answered back. And even if he forgets, and I call him and say, "Sir, this thing," he says, "Oh, I'm so sorry. I'll see it and I'll get back." And he does. So we've provided relief to so many parents thanks to sir.
Yeah.
So, sir, thank you so much.
Yeah.
Really, I mean, from my heart,
Uh,
appreciate the
Yeah.
kind of
Consider
dedication
this
you
as a
have.
duty.
Yes.
Thanks for giving this
Just not
opportunity.
like that. They say that, the doctors, everybody in our society is considered next to the God, they save life and nurture, when we really need somebody to support us. Thank you, sir, for always
Thank you.
being there to answer
Thank
our
you.
questions and address our concerns. And yes, we know this association is very, very long and might be lasting till eternity. Thank you so much for sparing your
Definitely. Thank
time.
you.
We know you
Thank
had
you.
to make a lot of adjustment and being with us today. I think we are good to go, and everybody is trying to thank you in the chat box also for your enlightening suggestions and your patient advices. Parul?
Thank you.
बहुत ही बढ़िया प्रेजेंटेशन आज का रहा है जो हमारे पेरेंट्स के लिए हेल्पफुल होगा। और हम उनसे जो है गुजारिश करेंगे कि यूट्यूब पर हम ऑनलाइन हैं अभी, तो ये लाइव में आपको मिल सकता है। और पूरा प्रेजेंटेशन आप दोबारा जाके वहाँ देख सकते हैं, चेक कर सकते हैं। अभी का अगर छूट गया है तो आप वहाँ पर जाके देख सकते हैं और बहुत सारी चीज़ों से, इन्फेक्शन से अपने बच्चों को बचा सकते हैं, क्योंकि डॉक्टर प्रदीप ने बचने के तरीके भी बहुत सारे बताए हैं उन इन्फेक्शन से, और उनके साथ में बहुत सारे मिथ भी जो हैं वो उन्होंने क्लियर किए हैं। थैंक यू।
Yeah, thank you, Pradeep sir.
Thanks a lot.
Thank you
Thank you
so
all.
much, DSFI.
Bye.
Thank you, parents, for
Thank you,
joining in.
sir.
Bye.
Yeah.
See you.
Thanks
Thank you,
and
Ma.
thanks,
Thank you.
Parul.
Thank you.
Thank you, sir.
Bye-bye.
Okay.
Bye-bye.